KZN Health MEC Nomagugu Simelane says the increase in COVID-19 cases in the province is alarming. KZN is trying to get back on its feet in the midst of relief efforts following deadly floods there. In the last 24 hours, the province recorded over 1,000 new cases. I've got the provincial breakdown here. Let's get you more analysis on this story. We're joined by KZN Health Department's HOD, Dr. Sandile Tshabalala. Dr. Tshabalala, it's great to have you with us on the program. And I suppose, along with the increase in infections, what's equally worrying is the spike, some would call it, in hospitalizations.
Good morning, Michelle. Good morning to the viewers of your program. Look, we are worried about the spike or the increase in the number of new infections, which is happening in the midst of another disaster in terms of the floods that have happened in the province. More so when we realize that the spike is happening mostly in the very affected provinces by the floods, particularly the district of eThekwini. If you look at the 1,700 plus numbers that you are referring to, you will note that 1,300 plus of that is in eThekwini. And the demand, therefore, on the health system in eThekwini has drastically increased. We have not seen a lot of increase in terms of the demand for COVID admissions. But remember that when COVID went down, we decided that we cannot be concentrating only on COVID. We have to attack all the diseases and attend to all the clients that we are servicing as a province. So we're worried about the floods disaster and the impact, because it's not only the floods and the clients of the floods. There is much more that is coordinated, obviously, by the Office of the Premier. But also the COVID-19 is coming with its own challenges. Yeah,
it's difficult because so many people are still crowded into community halls, Dr. Tshabalala, as a result of the floods. And then, of course, we're also going into the winter season.
Look, the reasons that we think may have contributed, you would appreciate that it was said that at some stage during the start of a winter, we may expect that the COVID numbers may increase. But the conglomeration of people in the different halls and different areas where people are accommodated currently due to the floods may also contribute. The third aspect that may be contributing is that the regulations have been made less in terms of us being able to go outside and not have a mask. But when we are in, even in that, we are supposed to adhere to the social distancing aspect. But it seems in some areas we do not even adhere to that. Those are the main three things that may be contributing. But also added to that, we are worried about the fact that our vaccination profiling tells us that we are just above 38% of fully immunized people in our province. That is very low. Hence, the MEC is worried about the increase in the numbers. The Premier and the Cabinet generally is worried, but also worried about the fact that people are not vaccinating, and we are urging people to go and vaccinate, because that will reduce the number of people that are going to be infected and be symptomatic. More importantly, it will reduce people that will be infected and need to be admitted, which will further give us a big challenge as a province in terms of the load of work that will then be given to our healthcare workers, who themselves may be infected and need to take some time off.
Yeah, certainly. I mean, everything that you've just said, Dr. Tshabalala, I mean, the bulk of where the solution lies, I suppose, to the situation in KwaZulu-Natal and around the country is increasing those vaccination numbers. I know that government is always running vaccine campaigns, encouraging people to get their vaccines, to get their booster shots as well. Will that be sort of increased in the province?
We've never slowed down. In fact, we started a new campaign which was aimed at making sure that we encourage people to go and vaccinate. And we continue with that campaign. On every Friday, we've got a chart that we are doing. We've got all engagements that we are doing. We even budgeted for such, even in this financial year, to encourage people. The Premier has also encouraged that in the district development activities, the Operation Sukuma Sake activities, the issue of vaccination and the issues of COVID-19 regulation adherence are discussed. And therefore, as a province, we've always been doing it. What we will do is to further engage communities at different levels and different sectors just to encourage people to vaccinate, because we think currently it's the only solution.
Yeah, and of course the NICD amid all of the coverage around COVID-19 in various parts of the country is also warning that, you know, we can't let our guards down because there's always that risk of a new variant as well.
It is doing so, but also there are other researches that are happening led by the National Department of Health under the Minister and the DG, Dr. Ptelezi, where they are checking where do the myths come from, and therefore how do we dispel these myths directly so that we do not just speak to the myths as we see them on social media, but we want to attack them directly, which is in line with what the Premier, the MEC, and all the leaders within the government of KwaZulu-Natal have been saying. So we want people to appreciate that the vaccine that they are expected to take is not different from all the vaccines that they took from birth until today. And we continue to do that, and we don't question them.
Yeah.
This one was developed just like it happens in every technological space. Even technology in the development of vaccines was quick enough for us to be able to get vaccines and get vaccines in numbers from different laboratories in the world. And therefore, there is nothing abnormal about this. All the myths that have been spoken about have not materialized. So why are we still thinking these myths are true?
Yeah, certainly. It's still a big issue that we are dealing with. Dr. Sandile Tshabalala is the KZN Health Department's HOD as we talk about a spike in COVID-19 cases in the province and particularly in the eThekwini region. Thanks very much indeed for your time.